Welcome back to the Sheol Podcast. In this episode, we are joined by Dr. Melvin Morse, who is a former pediatrician and a renowned researcher of near-death experiences in children. Dr. Morse shares compelling insights from his decades of work on what children see, feel, and remember from their profound near-death experiences. If this conversation resonates with you, don't forget to like, comment, and most importantly, subscribe to keep us exploring these deep and meaningful topics. So let's just dive in to our conversation with Dr. Melvin Morse.
So Dr. Morse, thank you so much for being here. You are a pediatrician, Johns
Yes.
Hopkins graduate. How did you first become involved? I mean, you are so well known for your research into pediatric near-death experiences. How did you become involved with that type of research?
I really had no interest in near-death experiences at all. I actually never even heard of them. Not something that is discussed at Johns Hopkins. Um, I want to tell you one quick story, though, when I was a medical student at Hopkins, that I think prepared me for my career. As a medical student, I worked with the great Vernon Mountcastle, and he's a neurosurgeon, and he did such operations as split brain operations and also removing half of a patient's brain. And they did that to control intractable seizures. So, although that seems very extreme, these are patients that otherwise were completely, seizing all the time. So, it was my job.
What year was that before you
That would have
tell the
been,
story?
let's see, I graduated in 1980, so it would have been back in 1978, 79. And Dr. Mountcastle removed half of the brain of a 13-year-old boy, and it was my job to examine him and see what the effects were. And it was very astonishing, Justin, that there was very little effect from removing half of his brain. He still had his personality, he still had all his memories, he still had a sense of humor, and he walked with a very slight limp. So that defies what I had been taught, and I think most people think of brain function. We think that the brain controls everything, and that it starts with the brain. So I remember on rounds, I said to Dr. Mountcastle, I said, "Well, what gives? I mean, this guy's hardly affected at all. You removed half of his brain. That isn't what the neurologists have been teaching us." And he looked at me and he said, "What the F do neurologists know?" And I think that did sort of plant a seed in my head that we can't necessarily, you know, I mean, everything in science, half of what we know is not true. The problem is that we don't know what that half is. We have to wait, as time progresses. Anyway, flash forward to I worked at Seattle Children's Hospital, and I worked for Airlift Northwest, which was an air transport company that brought critically ill children from Montana, Alaska, Idaho, and Oregon. And we had the opportunity to resuscitate a young girl named Crystal Merslock. She was an 8-year-old girl. She'd been underwater in a swimming pool for 20 minutes. And yet we were able to resuscitate her. It just, my mom always says there's no coincidences, but, she, just by coincidence, I happened to be working at a clinic in Pocatello, Idaho, and I saw her. She had been transported down to Primary Children's Hospital in Salt Lake City, and then she made a full recovery. And this was astonishing to me because she She had what we call a Glasgow coma score of 1, which very few patients recover from. She didn't have any of her
Wow.
protective reflexes. She didn't have a gag response. I had told her parents that she was most likely to die. And they came in and prayed at the bedside, and said goodbye to her and such as that. And yet she made a full recovery. In fact, when she recovered, the first thing that she said to her nurses was, "Where is Mark and Andy?" And the nurses said, "Who are Mark and Andy?" And she said, "Oh, well, they were my playmates in heaven." So I happened to see her in the hallway, and I went up to her and I said, "Oh, hi, Crystal. I'm sure you don't remember me, but I remember you. We spent a grueling day, trying to help you to recover." And she looks at her mother. She goes, "Oh, no. I know that man. He stuck a tube in my nose." And she then proceeded to describe her entire resuscitation. At the time that, well, her eyes, we taped their eyes closed because in case dirt or, things, we don't want to damage their eyes. So there's no way she could have seen any of this. And this is a time that I knew she was clinically dead. And yet she said, "I saw you working on me." She recalled conversations that I had with the nurses. She heard me. She said, "I saw you get on the phone and you were asking somebody, what should I do next?" Which was in fact correct. I saw you take me to a machine that looked like a donut, which was her description of a CAT scanner. And then I'm like, "Oh, great. What is this all about?" And she saw that look on my face, and she pats me. She pats me on the wrist and she says, "You'll see, Dr. Morse, heaven is fun." So that's how I got introduced to all this. I had never heard of these experiences before. Um, this was not anything that I thought, to me, when you're in coma, you don't remember anything. And when the brain dies, then consciousness stops. And that clearly was not the case with her. In fact, she said to me, she said, "I wasn't dead. I wasn't dead at all. Some part of me was still alive." So, at that time, I was a fellow at Seattle Children's Hospital. I was a associate professor at the University of Washington. So, I was looking for research projects, and returned to Children's and talked to the head of the Department of Neurology, the head of the Department of Psychiatry, the head of the Department of the Intensive Care Unit. So I always hear people say, "Oh, science, don't they discount the near-death experience?" Well, Justin, we were the medical mainstream, and we determined to study these experiences. It was our belief that these experiences were probably caused by medications, which cause patients to dissociate. Um, Even though, her story was very compelling that she was awake and conscious during her arrest, I didn't know really what to do with that. Um, it clearly did not come from her religious background. These were deeply religious Mormons, and yet Crystal said that she crawled up a tunnel to heaven that was lined with bricks. And she met a woman named Elizabeth who said, "I'm here to help you." Well, there's no Saint Elizabeth in their religious background. They didn't have any dead relatives named Elizabeth. There's no Mormon tradition of a brick-lined tunnel to heaven. In fact, I asked the mother, I said to the mother, "So, what did you tell her about heaven and dying?" And she explained, "Well, we think of the hand as the soul and the glove as the body, so that when you die, the hand comes out of the glove. Well, that was not part of Crystal's resuscitation at all. But even so, we were very skeptical. I mean, one case doesn't prove anything. Um, Oddly enough, the thing that affected me the most was when she said, "I saw you put a tube in my nose." And that is correct. I resuscitated patients by intubating them nasally, was how I had been taught. But that's nothing you'll ever see on TV. On TV, you only see the tube going in the mouth. So I was sort of alerted that, you know, something was up here. So we went back. I studied near-death experiences then, read up on them, heard what Elizabeth Kubler-Ross had to say. And, all of those studies are people that come to researchers and tell them their stories. Well, I mean, so maybe they're attention seekers, or maybe that, maybe they're just making these stories up to be on the Oprah Winfrey show, or at best, this is it definitely skews the population in terms of, you know, explaining what are these experiences, how common are they, were they of the nature that Crystal described. So we interviewed all survivors of cardiac arrest at Seattle Children's Hospital over a 15-year period of time. And we decided,
And that must be, I
yeah,
mean, you're talking to children, right? So this is much more compelling even than most NDE studies, because the indoctrination, the concept of what the afterlife is, I would think you don't have the same bias in children, right? I mean, you have
yeah.
a clear slate, clean
So
slate, so to speak.
exactly, and that's what we found out. In fact, most of the children that we interviewed um, had never even discussed their experience before we interviewed them. But so what we did was we studied the survivors of cardiac arrest, and then we carefully interviewed control patients who had the same lack of oxygen, had the same medications, were also in the scary intensive care unit, who frankly also thought that they had disease processes that they were going to die from. But we knew that they were not near death, whereas patients that survived cardiac arrest obviously are. In a 15-year period, we only found 26 patients who completely survived cardiac arrest. So, unlike what you see on Grey's Anatomy, it's actually bad to have your heart stop beating, and you usually die from that experience. Or if you recover, you're severely affected by it. So, we decided in advance. So, this is what's called a prospective study. And we didn't tip our hand. We titled um, our study the psychological consequences of the intensive care unit experience in a children's hospital. So, we didn't say, we want to know if they went to heaven or not. And our questions were all determined in advance. They were all bland, open ended questions. What do you remember about being in the intensive care unit? Things like that. And to our great surprise, a well-designed research study permits any type of result. And 24 out of our 26 children had some memory of the time that we knew that they were clinically dead. And most of them had not even discussed it with their parents or anybody until we came and interviewed them. So these are not attention seekers or making stuff up or, you know, um, In fact, I asked one little girl, I said, well, why didn't you tell anybody about your experience? And she said, I didn't think that you were supposed to be able to talk to God. So even at her age, she knew that, you can go to church and pray to God, but people who actually talk to God in our society are often considered crazy. And these children didn't just, their memories were precisely at that time that they were clinically dead. So it's very interesting. I'll give you an example. One little girl, I had to put a needle into her heart to resuscitate her. So that's near death by any criteria. And as your listeners may know, or I'll just tell them, conventional neurology says that when you have extreme trauma, you lose your short-term memory. So most people that are in traumatic events don't remember anything for 6 to 8 hours, prior to the event. And that's exactly what this little girl displayed. She had no memory of coming to the hospital. She had no memory of being in the intensive care unit. In fact, she didn't really have any memories until she was finally discharged and she was at home eating a popsicle. So that fits with the neurology that I was taught. Except, she said, oh, you mean when I heard you ask the nurses for that crash cart thing? And she said, and then I saw my grandmother. And she was just sitting there on a chair. And I was just so shocked to see her because she had, previously died. And she drew me a picture of her grandmother surrounded by a bright light. And then she looked at me and she said, and then I was back. And I said, what do you mean by that? And she goes, that's what I'm trying to figure out. So, to be able to interview these children for the first time is it was a privilege. And, it's really one of the reasons that I want to share these experiences with others. Because, when you hear these stories from adults, they're all these sort of seamless stories that, have a beginning and an end. But children, the first time they tell the experience, it's something real. When she's saying, that's what I'm trying to figure out. Well, that's not something that she's confabulating or making up. And I was just so shocked to see her. But even more interestingly is that clearly in her case, that when she was at the point of death, consciousness returned. And that's when she became conscious, was in that moment when we were resuscitating her. And this pattern was again and again and again. And I'll just share with you a couple of other stories because they really illustrate that these stories, okay, well, a confabulation is when we try to make up a story to fill a memory gap. It doesn't mean that people are doing it deceitfully or to fool anybody. It's just the mind hates memory gaps. And so, it's very common. You say to somebody, what did you have for breakfast this morning? And they simply can't remember, but they just make something up. And, oftentimes they believe it to be real. These are not confabulations. These are not stories they're making up. One little boy that we resuscitated, he was underwater for 45 minutes. His parents were ski instructors. They were coming home from the Cascade Mountains in the driving snow. Their car skidded, flipped over a barrier, and plunged into the water below. And he was under there for 45 minutes. Uh,
And can you tell, because you're a physician, can you tell our listeners and our viewers like what the expectation would be reviving someone who's underwater for 45
You know,
minutes?
you're not going to survive, that type of. On the other hand, you're not dead until you're warm and dead. Is sort of a truism in the intensive care unit world. But nevertheless, I think common sense and also our clinical experiences that we thought this child would have no chance of surviving, and he did. He completely survived, and he was entered into our study. And I went and interviewed him and asked him, well, what do you remember, about the time that you were in the intensive care unit, the time that you were sick? And he says to me, well, I was in a huge noodle. And again, no memories of what happened before, no memories of what happened afterwards. But at the time that he was clinically dead, he did have the return of consciousness. He said, I was in a huge noodle. And then he goes, oh no, noodles don't have rainbows in them. So it must have been something else. And he described going to what he called the animal heaven and then the people heaven, etc. But when he says something as striking as that, uh, I was in the huge noodle, but it can't be a noodle because it had a rainbow in it. That's not something he's making up. He's trying to explain a powerful experience that is beyond his comprehension. And that's basically what we heard from all of the children. Many of them described their own resuscitation in detail. One little girl, she drew a very detailed picture of her own resuscitation. She drew my partner, David Christopher, who had his hands in perfect position on her chest as he was doing CPR on her. She drew that. She drew a figure at the head of the gurney wearing a hat. So why is that of interest? That was, in fact, at our hospital, we had the team leader wear a hat so they could be quickly identified during the time, the hub of resuscitation. We want to know who is the team leader. So they get all these little details correct. And, there's all of our control patients who also had a lack of oxygen to the brain, who also treated with the same drugs, same psychological stresses. Parents also thought they were going to die. They fit what I was taught at Johns Hopkins. They had no memory of being in the intensive care unit. And for people who think, well, this isn't science, we published this in the American Medical Association's pediatric journals. We published 3 articles on this. Pim van Lommel, a cardiologist in Holland, he and I discussed our research design. He also did a prospective study, and forgive me. Anyway, so Pim van Lommel did a similar study to ours, a much larger study, and published it in the Lancet. And I'll just share with you, just to put the final, that near-death experiences are real, that they're the dying experience. A study came out of the National Warfare Institute, in which Jim Winery, who I've discussed, we've compared notes on our various studies. He wanted to know, for the purposes of flying fighter jets, what are the tolerances of a pilot from tremendous G-forces? So he whirled them in a centrifuge until they came to the point of near death, till, in theory, the blood stopped flowing in their brain. And his study showed exactly what our study showed. His pilots lost consciousness, frequently had seizures, lost bladder and bowel control, and then, At the point of near death, consciousness returned to these pilots. And the types of experiences they had were the same experiences that our children had, that Pin von Lummel's adults had. They had bright lights, out-of-body experiences. They thought they were with God. These types of experiences. They're very transformative, by the way. Several of the fighter pilots that he put in the centrifuge, after they had that experience, they immediately resigned their commissions and did things like went into family practice, did therapy on other veterans, things like that. So these experiences are very transformative. But they're simply, from a scientific point of view, Jim Winery published his study in Archives of Neurology. So you got the Lancet, you got the AMAs, medical journals, Archives of Neurology, and there's numerous other studies in the medical and scientific literature. There simply is no doubt that it's not a near-death experience. It is, in fact, the dying experience. Peter Fenwick from England, he did, again, a prospective study. In other words, identifying patients in advance and seeing what happened to them. He identified dying patients who permitted him to study them, and he found that in the last day of their life, they described the exact same things that, in fact, that we saw in our near-death experiences. These are patients who actually died, and yet, as they died, they would see dead relatives, bright lights, spiritual events. They often were very comforted by the experience. They often knew that they were going to another reality, a reality that they often thought was heaven, and such as that. So, Justin, I guess I'm dwelling on this point for a specific reason. I go on Facebook every once in a while, and it breaks my heart. There are people, they describe their experiences, their near-death experiences, and then they go, oh, but that wasn't really real. We get various trolls on these, Facebook, groups that say, oh, science doesn't believe this, blah, blah, blah. Actually, we are the mainstream scientists. As a critical care physician for 20 years, um, you know, Ben von Lummel, one of the most prominent cardiologists in the Netherlands. Uh, there's simply, from a scientific point of view, the question is answered. This is the dying experience. We will all have this when we die.
Yeah, this is a really good point that you bring up, because I've been that person as well that looked at some of these stories and said, I think the patient in room 4 in the emergency room, they don't know what they're talking about. They're hallucinating,
Yeah.
whatever the case may be. At
Yes.
the point that you started this study with children, was this the one? Did you say this was in Seattle?
At Seattle Children's Hospital.
Was this the moment that changed your mind? What was your perspective about death and the afterlife before you came
I
into
really
this
never thought
research?
about it. Um, I pretty much was just involved in my medical training. I was raised a Jewish tradition, but we were sort of, my parents were kind of atheistic Jews, more cultural Jews than anything else. Um, we occasionally went to synagogue. I certainly had no belief in a God, certainly had no belief in an afterlife. I always believed what I was trained to believe, which is that consciousness is created by the brain. And so obviously when the brain dies, that's, you go into darkness. That's the end. That was certainly my belief. And I have sympathy for people who have a hard time believing these experiences because they're counterintuitive. And everybody on our team had a hard time believing this. It was not unusual for us to go, well, these are the results of our study, but this can't be real because it's too counterintuitive. And another thing, Justin, you have to understand in the scientific world, if we don't have a mechanism to explain something, it doesn't matter how much evidence there is. That the scientific mind needs an explanation. The most famous example of that was Samuel Weiss, Viennese physician in the 1800s. He discovered that if he washed his hands before delivering babies, especially if he'd come from the morgue and handled dead bodies, just by washing his hands, he could dramatically increase the chance that they would survive, that they would not die of maternal sepsis. In those days, it was a high risk to deliver a baby in a hospital. So you would think that all of his fellow physicians would be saying, yay, we're going to wash our hands too. That is not the case. Samuel Weiss was ridiculed. What you're saying, tiny invisible agents of disease, are are responsible for the death of these patients. No, it wasn't until Lister showed that germ theory was real and microscopes could actually see various agents that cause disease. Only then was the idea of washing your hands, and then it happened overnight. Within 10 years of Lister, all surgeons were washing their hands. But and there's so many examples of this. The continental drift theory. Even though it looks, you can look at a map, you can see how all of the continents seem to fit together. That was proposed by one of the leading geologists in the early 1900s, that there was continental drift, but there was no mechanism for it. He couldn't explain how it happened. So continental drift, until tectonic plates were discovered in the 1960s, nobody believed in continental drift. And the same thing is happening today. And I hope that we'll get because right now we are developing theories of how this can happen, how the near-death experience can happen, how consciousness can survive the death of the brain. We're at a paradigm shift. Thomas Kuhn wrote about paradigm shifts in Western civilization. He talked about the various stages of them, and I believe that we're in what's called stage 3. That's the stage where the old theory clearly does not explain the evidence, but the new theory has not yet become established. And, so but that's where we're at now. Materialism, the old, there's not even a scientific definition of material anymore that everybody agrees on. Theoretical physicists have told us for 75 years that matter does not exist, that reality as we know it is really made of electrons and quarks, electromagnetic, a field. So that we live in a gigantic electromagnetic field. Theoretical physicists have told us that even time and space are invented by our brain. So we're at a time now, Justin, where This is turning everything upside down. Time and space, even colors, are invented by the brain, and yet consciousness apparently is not invented by the brain, is where we are right now in terms of scientific thinking about what happens with consciousness and the death of the brain.
Yeah, it's very. I think I've said this before, but Dr. Sam Parnia described in his book the idea of telling somebody 100 years ago what it'd be like to go to space and how they'd never be able to comprehend that that was possible. And he poses this theory like, what if we are seeing into the dying experience? What if this is reality? Even though now it feels counterculture, I think because of work like yours and other pioneers in this research, that's going to change. Um, has it, do you have theories yourself personally on what is happening with consciousness during an NDE?
I don't want to say that they're my theories. I think that what I bring to this field is that I'm a generalist. And this is an area that we need generalists because everybody has their own little niche and nobody is talking to each other. So the people that are doing consciousness research are not talking to the people that are doing near-death research. And the theoretical physicists, even though they write books in their spare time about that the universe is conscious, those people aren't talking to the remote viewers. Um, so uh, there's we need generalists, but I don't want you to think that these are my theories. Um, However, having said that, my understanding of reality is this: that reality itself is an electromagnetic field, that time and space do not exist. So that's what theoretical physicists see. If you ask them what is a chair, they're going to tell you, well, a chair from a practical standpoint is something you can sit on. But if you ask what it's made of, it's not made of anything. It's mostly empty. Uh, in fact, it may not exist at all if we're not observing it. It may simply exist in the realm of probability. That mathematical terms are necessary to describe what a chair really is, that language can't even do it. So that's what ultimate reality is. The children that have seen it say, it was real, Dr. Morse. It was realer than. So what is this? What is the experience we're having? This is now, I'm going to tell you Neuroscience 101. What I'm going to share with you, if people want to learn more, they can go to PBS, the 6-part series on the brain. So what I'm going to tell you now is not controversial. Our bodies have bioelectric sensors, and we sense the electromagnetic field that we're embedded in. And those biological, electrical sensors translate that information into signals that are then transmitted to our brain. And then our brain takes that information and creates a model of reality that exists within our brain. So in other words, our eyes are not video cameras. Our ears are not, speakers or microphones or, etc. Not at all. They're information processors. And this fits with what the theoretical physicists tell us. John Wheeler says that the world is actually made of information. So that information is then taken by the brain, and we create this internal model of reality. And we all share it. So, for example, even colors don't exist in nature. You think you're seeing a color, you're not. You're seeing information which your brain then translates into a color. And we spend a lot of time teaching each other how to communicate with each other. When we're 2 and 3 years old, our parents are saying, that's red, that's red, that's red, that's red. It takes a long time to learn what red is. So these models of reality, that's what the illusion is. That exists in our brain. We don't even, we don't even, we don't even really perceive this reality. We more sample this reality. It's been shown, for example, if you look at a painting, you don't actually look at the entire painting. You just look at a few points of it, and that's enough for you to then fit that in with your mental model of what you think the painting should be, and that's what you actually see. So this then explains the near-death experience. That when our brain dies, obviously our mental model dies. And we're plunged into darkness because we're not seeing anything. We're not processing information anymore. This concept that we live in a sea of information and that we are just information processors who are creating our own sense of reality. Let me tell you how well this is established. Neuroscientists at Stanford have taken visual signals and translated them into tactile vests. A vest that someone can put on their chest. And they take the exact same visual information, but instead they translate it into something that the person can feel. But it's visual information. And the brain takes that information and creates a visual image. So the brain doesn't care where it gets this information from. It's just driven to process it and create it. And if it doesn't get information, it often makes it up, which, is the problem with eyewitnesses in criminal cases. That, we don't really see anything. We really are comparing everything we perceive to our inner mental model of what we think we should see. And so that's the near-death experience. The mental model dies with the brain. We're plunged into darkness, but consciousness persists. So this is called top-down causation, and meaning that consciousness comes first, and then consciousness works through the brain, works through what we call physical reality. And under this thinking, everything has consciousness, even rocks, are conscious. Lest anybody think this is a bunch of new age, touchy-feely stuff. Actually, Robert Lanza, who is arguably the world's smartest scientist, who at age 13 interacted with physicians at Harvard University, and he told them about studies he was doing on chickens. That's how smart he is. And yet he came up with this idea probably 25 years ago. Stu Hameroff and Roger Nelson. Stu Hameroff is an anesthesiologist. Roger Nelson, physicist. They have also come up with their idea of consciousness, being the substrate of reality. I understand how hard it is to. I've had the same problem myself. It's taken me years to understand this stuff because we're saying time and space isn't real, isn't a function of reality, but consciousness is. Well, that certainly isn't what I was taught. But I mean, this is now so well known that you don't have to read the New Age journal to get this stuff. Popular Mechanics regularly has articles on top-down consciousness and how consciousness is the glue that knits us all together. And that makes sense because the theoretical physicists tell us that space doesn't really exist, that everything in this reality is what they call entangled. If you have a minute, I would like to tell your listeners what entanglement means, because we hear that phrase all the time, and I don't believe anybody understands it.
Sure.
And
Are we talking about quantum entanglement?
The idea that we are connected to every single thing in this universe. So that's what the physicists mean when they say that space doesn't exist and time doesn't exist other than constructs of our brain, that everything is entangled. So how do they know that? Simple. What they do is they take a beam of light that's emitted, let's say, they create a beam of light. They take that beam of light and they split it into two parts. So you now have two beams of light that came from an original source. Then when they have that beam of light, it's split into two parts, they take one of the beams and they change its color. And instantly, the other beam of light also changes its color. So that's entanglement. That's the type of experiment that you do. It's an experiment anybody can understand, although comprehending it, as a physicist famously said, if you think you understand, theoretical physics, and you don't understand it, because it's just, well, why do we have this mental model? Why do we have this invented world that we all communicate in? Why do we think we're separate, even though we're clearly entangled and we're not separate at all? A physicist at the University of Maryland, here's how he explained it to me. He said entanglement means that you have a coin, but the head of the coin is on the East Coast and the tail of the coin is on the West Coast, and yet it's still connected. So why would we have this? Well, when I talk to the children who have near-death experiences, they tell us that we are here to learn lessons of love, that this reality actually has a purpose, that we're here to learn specific lessons of love. And you hear this in adult near-death experiences all the time. One of the most beautiful near-death experiences I ever heard from an adult is a physician named Robert Kennedy. He nearly died. He was almost murdered. And it took him years to process his experience. And he now works with families of murder victims to let them know. And he says, we do not die alone as you would fear. As you would fear that your loved one died alone. But that is not the case. In fact, we die in a sea of love, a love that's so powerful that I learned, if my experience means anything, that this life is about learning to love like that. Or even more importantly, to learn to accept the love that others have for us. So, when you have to put all these little pieces together, but yet, it's clear to me, uh, I'm 40 years into this. I can't tell you this all came to me at once, but, we're here for a specific reason. That's why we have this invented reality, which the neuroscientists and the ancient Buddhists agree on is an illusion. So, going back to Facebook, Justin, oh God, I mean, people describe on their spiritual experiences, which you could start a religion from. I mean, they're so powerful, they're so moving. And then they go, oh, it must have been some dream, it must have been a hallucination. But science tells us that this is the hallucination. Well, I mean, not, you know, this is the illusion, is a better word. Um, and that the near death experience is reality. That's our glimpse of what is real. Just
Let
go
me
on.
ask you a question about that. I don't want to interrupt you, but you are so well versed in this subject, and there's very few people that are well versed in childhood NDEs. And you talked about the profound impact that these experiences have, and because NDE experiencers or people that have NDEs say
Yeah.
it's more real than reality. Do you find with the children, did the experience consistently impact them in that way? Does it fade as they become
So
older? What type of impact did it
we
have?
studied these children later on. Um, uh, uh, there's in a book called Transformed by the Light. Um, but we studied adults who had near death experiences as children. And then we also studied the children in our study 10, 15 years later. And they had a post traumatic bliss syndrome, is what I call it. These experiences never fade. And they give them a sense of purpose and meaning that, I think that otherwise, oftentimes we don't have. When, people often, wonder what is the meaning of my life? Why have bad things happened to me, etc. And yet, when you talk to those who have the near-death experience, it's really very different. Um, they know what the meaning of their life is, and it never fades. I'll tell you a funny story about that. When I was a pediatrician and I was counseling a young man on uh, getting his tonsils out, his grandfather was there in the room, and his grandfather started saying, "Tell him about the tunnel." And I was like, "Well, I don't think that's one of the side effects of having, your tonsils out." And the grandfather's like, "No, no, tell him about the tunnel that goes into the light that teaches you that we must love everybody." And and his daughter was shushing him, etc. But in fact, he had had a near-death experience when he was a child, when he was 4 years old, when his tonsils were out. He never forgot it. And when we studied these adults, we found that they gave more money to charity than our control groups. We had a couple of different control groups. We had a control group of people who had nearly died but didn't have a near death experience. Because after all, maybe just coming to the brink of death, changes you. We had a variety of different control groups, and those who had near death experiences were profoundly changed. And they gave more money to charity. They were more likely to be in helping professions. Um, they identified love as what they considered the meaning of life. When we gave them uh, uh, death, death anxiety scales, they had very little death anxiety as compared to our control patients. One of the little girls explained this to me best. She said to me, I'm not really afraid to die anymore because I know a little bit more about it now. So, I want to share something with your listeners because I think we're all troubled by this. What is the meaning of our life? Why have bad things happened to us? We don't see, if you don't understand that we're learning lessons of love, it's very hard to understand, why would some tragedy happen to you? Why, why would you suffer the loss of a child, for example? Or, any of the number of terrible things that seem to happen, the suffering in this reality. And I asked one young man, in our study, he'd had a near-death experience as a teenager, and then I interviewed him again in his early 30s. And he said, well, I learned from my experience that I have a job to do. Like, oh, okay. So, I'm like thinking he's going to tell me, it's a cure for cancer, or, this is, back in the early days when I was studying this stuff and didn't quite believe it. I know that sounds odd, but it's really hard to truly understand this information. And he saw that look on my face. He says, "No, you're totally misunderstanding me. I already told you what my job was." He ran a small remodeling business, and he hired all his friends from high school. And he said, "Those numbnuts, they could never get a job if it wasn't for me hiring them." So that's what he considered to be the meaning of his life, running this small remodeling. And it even went even further than that, Justin. I interviewed one of my, original study patients 15 years later, and he said the same thing. He said, I learned that there's a special purpose to my life. So, like, okay, what's your purpose? What's your special purpose? I'll bite. Tell me what it is. And he said, maybe I'll never know what it is. I don't know what my purpose is. Maybe it'll be that I walk into a street one day and a car will stop because it doesn't want to hit me. And then that'll set off a cascade of events that then will have some special meaning for somebody that I can't even understand. That's the type of thing that people who've had near-death experiences come away with. That's what they see as the meaning of this life, that we're here to learn lessons, and that whatever happens to us, we're going to all get a big hug from God when we die. We're going to get an attaboy. Even Nazi prison guards had near-death experiences. And, I don't know if my brother-in-law is Raymond Moody. So another kind of non-coincidence, as my mother would say. I happened to meet his sister-in-law, and we fell in love and got married in our 60s. So anyone who thinks you can't find love in your 60s, we found true love in ours. Anyway, so Raymond Moody, he's kind of a contrarian. And, he's been asked these questions 3 million times. So sometimes he just wants to play around and have some fun. So I heard him once. He was asked, so what was the most meaningful near-death experience that you know of? And Raymond said, oh, it was Saddam Hussein's. And Saddam Hussein actually does describe some spiritual experiences in his writings. But Raymond did that because he wanted to shock people. He wanted to let people know, wait a minute, we're all here to learn lessons of love. We can't judge each other. So, people that we consider to be sociopaths or, you know, Saddam Hussein's, who at least in our culture we consider to be a monster, Nazi prison guards, and yet they have near death experiences and they find meaning in their lives, and they're going to get that same hug from God when they die. What else? What other questions do you have?
Well, you honestly are answering a lot of questions before I get to them, which is great because we're getting we're getting it all out there. Um, so this is not a question we had written down, but I am curious. Childhood NDEs. We did an episode of the show at the very beginning on childhood NDEs and what children experienced and what they talked about and what was documented. Um, and I wonder if your personal experience talking to these people impacted the way you practice or the way that you talk to families who have lost a loved one or are on the cusp of losing a loved one. Um, how has it impacted your practice in that way, or how did it impact your practice in that way?
You've asked a really difficult question, Justin. And the short answer is that if you're a grieving parent, you don't want to hear anything from anybody. Um, a grieving parent once said to me, uh, here are the top 10 things you should never say to a grieving parent. And I, at that time, had said every single one of them. So, um, the best thing that you can do with a grieving parent is to say nothing, is to sit there with them and share their pain and talk to them about, you know, listen to them, listen to what they've experienced. It's best to really just say nothing. But if you listen to them long enough, you can prime the pump by saying, I've had patients who've had this type of experience. Certainly in my position as, as a physician who studied near-death experiences in children, I can tell them, I said, I have had children that have come to the point of death, and here's what they've told me. And if you listen long enough, that parent will often tell you something that they themselves have had a hard time coming to terms with. In other words, they'll tell you about some sort of experience that they've had that um, can plant the seeds of healing for them that you can reinforce with them. So, for example, I was working with a young woman, a terrible accident that she had, um, in which she was driving in her car and she made a left turn into traffic, and a was struck by a car. She turned into an oncoming car, and her son was killed. Um, he was in the hospital for I think a week or two, and then finally succumbed. So as I sat there listening to her and talking to her, here's what she finally told me. She said to me, "My son had a dream several weeks before he died. And his dream was that he was a Ninja Turtle and that he was very excited about it. And he said, Mommy, I'm a Ninja Turtle. I'm a Ninja Turtle. So what happened with him, he was severely injured. He had a cast over almost all of his body. And the mother was sitting at his bedside, and a nurse came in and said to the mother, your son looks just like a Ninja Turtle. Because of the way, the various, the casts were around his body and such as that. And I talked to that mother about that. And I said, so what do you think that means? And then she herself said, maybe my son had a dream of what was going to happen to him. And then that dream created a sense of meaning for her, because the meaning of her life was destroyed by her son dying. And that's what then leads to pathological grief, because life has no meaning anymore. And so I wouldn't say I made the connection for her, though, but by just listening to her and just commenting, she herself made that connection. And then that restored meaning to her life. And she then went on the path of finally being in the realm of healthy grief. And a year later, she did tell me that she learned that grief can lead to growth. So that's the type of thing. I think that listening to parents long enough and then reinforcing what they otherwise think is a crazy dream is, I think, one of the best things that we can do. I can think of, many examples of this sort of thing. I'll share with you one that came out of my study. The boy that he had the experience of going into the noodle, and he was underwater for 45 minutes. The circumstances were that the mother was in the passenger's seat. The father was driving the car, and then two children were in the back seat. The car flipped over a guardrail and plunged into the river below. And we ultimately resuscitated the young man, and the mother freed herself by kicking out the windshield and then swam to the surface. And she was sitting on a rock, and first responders had put blankets on her. And this young man, he was talking about his near-death experience to me, and then he goes, "But was it real, Dr. Morse? Because if my experience was real, you have to tell all the old people." Well, she then said to me, and I want to know if his experience was real, because I also had an experience. And if his experience was real, then mine is too. And here was her experience. Her experience was that as she was sitting, on the rocks, looking down at the first responders, trying to rescue, her husband and her children, she had the experience that her husband was sitting next to her, and that he was just as real as as any other experience. And he looked over at her and he said, "Everything is as it should be. Everything is okay. You don't need to cry." And she looks at him and she said, What do you mean? Everything isn't okay. They're down there trying to rescue our kids, and you're just sitting here doing nothing." And she screamed at him and started shaking her fist at him, and he then disappeared. And he, in fact, did die in the car. He, in fact, did not, uh, you know, he was not, in fact, sitting next to her. So she had, I guess, an after-death visitation or a communication. And the reason I'm telling you this in the context of you asked me, how has this changed my practice? Is it's made me aware that premonitions of death, after death communications, shared dying experiences, all of these experiences are just as real as the near death experience. And that when we take the time to listen to parents or, anyone who's grieving, by and large, I find that they've often had these types of experiences and they dismiss them. They just think, oh, it's just some crazy dream. It's just some crazy experience. And, so I think that by validating them, by being able to say to them, no, I believe you. I think that what happened to you was real. That can make a tremendous difference. And that is what I've counseled, I don't know, hundreds of grieving parents. And that is the approach that I take. Not to give them any advice, not to tell them that I know what they're going through, but to listen to them, to hint at maybe their spiritual experiences, uh, but in a very vague way, or maybe talk about my near-death research, but not as if it has anything to do with them. And then they themselves will often tell these stories, and these stories are powerful stories that can heal grief. And we proposed in 2004 that there was a God spot in the brain, that all of us can communicate with God. Nobody has to think that their experiences with God are hallucinations. Since that time, there's been no pushback from the scientific community. Well, the only pushback came from Mario Beauregard. He used to be at the University of Toronto, or used to be Montreal. I'm not sure where he is now. But he said, no, it's not a God spot, it's a God brain. That 30% of our brain is hardwired for the universe. But even skeptics such as a guy wrote a book called The Spiritual Doorway to the Brain. He also outlines in his book all of the spiritual hardwiring that we have. He just doesn't happen to believe that the spiritual reality is real. Well, that is a matter of faith. But I do want to emphasize that no one doubts that our brains are spiritually hardwired to connect with a spiritual universe. So I talk about that in the website melvinmorsemd.com. I have another website I'd love people to go to. It's www.issscusa.org. And that's my Institute for the Scientific Study of Consciousness, founded by Charles Tart in 1979. We're very honored that we could pick up his work. One of my associates is Dr. Guiona from Spain. He's the leading researcher in this concept that the brain is an antenna in the informational universe. And you could read more about that. It's issscusa.org. And we have a book out that I hope people will take a look at. It's an urgent message for mankind. We did a study of mediumship, and we, instead of asking mediums questions, we coded the questions as numbers because we figured if they're really mediums, if they really can communicate, with the spiritual universe, well, we shouldn't have to actually ask them a question in words then. So we translated our questions into numbers, and sure enough, the mediums who had no idea what the question was were able to answer them.
Yeah, we'll put those in the show notes as well. Because I was aware of the Melvin Morse website. I was not aware of the isscusa.org. So that's something we'll point people to. But I really appreciate your time. I mean, thank you for being with us and having this discussion today.